this. So if anybody couldn't make it, there will be a recording available. So you have to share it. If you have somebody you know couldn't make it and you'd like to share it, just let Dr. Team know, and they'll send the link because it'll all be in the beautiful cloud above us. So my background, you guys, is you. So my story is that I started out as one of those little tiny dental assistants back in the day, and I worked for an incredible dentist. He took me everywhere. When we were learning about implants in, I'm going to date myself, 1983, we were placing blade implants back in those days. And our hygiene department was one of the most cutting edge hygiene departments in our town. And I had the opportunity to work with him, and he took me to all these places. He made me fall in love with dentistry, particularly innovation. And he had everything. Do your doctors, like some of you have, like they go to a program and they come back with everything in their hand? You're going, now what did you bring me? What am I going to have to do now with my patients? What am I going to have to do with this piece of equipment? But the beautiful thing is that it's making our job easier. Anybody from the hydrocolloid impression days? Do you even know what that is? Oh, there we go. There's kindred spirits. Today with scanners, you can do so much more, so easy compared to what we did with these crazy hydrocolloid impression drills. Just bring me back a moment what it was like. There were warming tubs in the operatory. So if a hygienist or an assistant had to take an impression, they'd go and pull these tubes, plastic little tubes out. They were sitting in this warm bath. It was green, right? It was green. They must have been traumatized. I remember all of it. And what happened was that we had to take those and squirt that goo, and I mean, it was gooey, in this super thick tray, metal tray that had tubes coming out of it. You had to put that in the patient's mouth, hold it, 10 minutes? Was it close to 10 minutes? 5 minutes? 5 while you hook these tubes up to run cold water through it, to harden the material. So can you not only imagine what it was like for us, but for the patient? It was, we got this harmful impression, we had all kinds of great. So you're in a great time in your career. You're a great time in the world to have all this incredible innovation that's available to you, and more coming down the pipeline. Question for you all. How many of you use 80% of the time you're using some form of technology like a piezo Cavitron, just with a raise of hands? So interestingly about that technology, a lot of the hygienists were using hand scaling for years. That's how you were taught. And your little wrists and your fingers and everything really got out of control with how uncomfortable it became for you. It was very hard on you. And when Cavitrons and piezo technology came out, it was really because of Esther Wilkins. You guys still look at her bias, and isn't that amazing? Crazy, isn't it? Esther Wilkins came out with this idea that lifts them up. We've got some problems, and we need to look at them a little differently. And what happened was piezo technology, Cavitron technology, became the rule in her book was 80-20. 80% of the time, you should be using electronics like piezo and Cavitron technology because it disrupted the biofilm. And hand scaling in certain situations, and a lot of situations, would literally drum the biofilm little sphere, never really opened it up so your medicaments could get in. So she was very, very smart about the technology and understanding 80-20 rule, 80% ultrasonics, 20% hand scaling. So she's been one of the most impressive people in the world of hygiene for a very long time, and just really a neat forward thinker. So the other question I have for you tonight, and I'm going to be giving away a few things that I know you guys love. So with a raise of hands, how many have been a hygienist for 5 years? How many? Way up, so we can break. How many people have been a hygienist for 10 years? How many people have been a hygienist for 15 years? How many people have been hygienists for 20 years? Oh my gosh, you kind of hanging in there. Wow. I would love to have a helper. If somebody wouldn't mind helping me. Would you please pass that because it's almost Halloween?
Yeah.
I want to get a little treat. So raise your hand for 20 years. How many years? Let's see if there's anybody in here with 40. 44. Wow. 50 years.
Debbie,
Oh my.
Debbie,
Here in the Carolina.
she's not listening.
Yeah.
Debbie,
Holy cow, have you guys seen the changes, right?
Debbie,
5
I'm glad I don't have a question.
5 years before you became a hygienist. Wow. So you've been in the profession a total of 50 years. In the profession for 50 years. She must like it. She must like it. That's the way I felt about it too. You know, it's very important tonight. I know we're going to talk about some new innovations. We're going to talk about things that actually are really impressive when it comes to wound healing. We're going to talk about some of the really exciting things that are happening that I truly believe is going to make a huge difference for you all in actually getting your patients to where you can get them into a remission state, that they don't do everything that you ask them to do and still come back with disease. So frustrating, right? So I'm going to show you some new things that are on the horizon that we're understanding better and better about disease overall and how you're not just teeth cleaners. You are healthcare providers and you have a very critical role, more than you ever imagined, on even saving lives in some cases. How many of you take blood pressures in your office? Great. And there is a brand new book, and I apologize because I didn't get the slide up in time. There's a fantastic book. I want you to write this down. I know you have paper. Write it down. It's a book by Dr. Allie Campbell. And she is a doctor in Atlanta. She just wrote a book, it's, I believe, out on Amazon. And the book is about how to properly take blood pressure. Because we're discovering we've been taking it wrong all along. She said the numbers can vary dramatically. So I really encourage you to have at least a book in the office to share and talk about how we can improve our ability to take blood pressure. So there's a lot of things we're going to talk about tonight. There's a lot of things we might divert off into. I love it when you ask questions. I want us to all interact. You've had a long day. And I want you guys to be able to enjoy your evening tonight with me and learn something new. So we're also going to go over, you guys find that like, I guess. We're going to talk about Peri-Implantitis. And we're going to talk about Dr. Giorgio Tsoukalos and his amazing research he's been doing at the University of Texas, San Antonio, and what they're finding under the microscope, which I think will be a very surprise to a lot of you, which is wonderful. Oh, thank you for sharing with you. My other group, I forgot about you guys. I think we need a window.
Yeah.
Or we need to just smell and scream on him. So we're also going to talk about tonight some of the really important alternatives to something you were all trained with and maybe can be using still today, which is chlorhexidine. And I'm going to show you some really intriguing science on this. And what we've all been searching for is an alternative, particularly in wound healing. It's vital that we learn these things and know. And then we're going to talk about our high-risk patients. We're going to talk about these tools because my firm belief is that you could come and spend a lot of time in a meeting, but darn it all, you never know what to do when you go back, right? All of a sudden the world starts turning again. People are overscheduling you. You're running around, you're yelling at the front office, you know, what are you doing? You're killing me. And all of a sudden, all the good stuff you had in your head is just gone because you're like, I have to get back on this wheel again. So tonight, we're gonna also walk away with some good ideas of what we can easily implement simply on the next day. So I want to be able to bring that to you. So this was always very interesting to me. What's the horizon? What are we doing? What's happening out there in our world besides our little world? What is going on? So in 2023, the dentistry outlooks, we were just talking about this earlier, or alternative therapies are on the rise in the dental practice. These lovely ladies here and I were just having a conversation about Medi-Spa. Any of practice here have a Medi-Spa in their practice? This is gonna be super cool. When it starts to creep into your area, you're gonna find that Medi-Spas are going to be a really interesting and addition to dental practice. What's happening right now, we'll go there just for a moment to talk about this. Patients go where to get Botox? They might be able to do it in some of your offices here, but where do they go? They go to an esthetician. Where do they go to get facials? Medi-Spas, all of these alternative estheticians, they will do that for you. What's happening in dentistry right now is there are offices all across the country that are creating Medi-Spas right within their walls. And what they're doing is they're using PRF, protein-rich fibrin. Anybody know a little bit about protein-rich fibrin? It is your blood spinned in a centrifuge to separate these amazing fibroblasts, amazing stem cells. They take that top portion of it and they suck it out with a little syringe. They use that for Botox instead of Botox. And what's happening in dentistry is people want their beautiful smiles. They want to have their teeth repaired and have a lovely functional mouth to smile with and eat with. Then they start noticing something else. What's that? What happened? What happened? I got little wrinkles I noticed now. What is on here? Oh my gosh, what happened? I got old is what happened. We oxidized. Oh, we'll talk a little bit about that too. But when you take these concepts and these new alternatives, patients love you. They love you. They don't want to go anywhere else. And so what's happening is they're creating these environments where patients can have these alternative therapies. So bear that in mind because this is on the rise. Implants. How, well, lovely ladies who've been around the block like I have for 40 or more years. How many implants would you say you saw 20 years ago? Few every now and then? Yeah. A few, right? Just a few. How many implants do we see today? Almost every day. So implants are becoming a huge major factor in our dental practices, and you as hygienists are responsible for caring for those implants like you care for a patient's overall well-being and their oral health. So I'm going to show you tonight some things that are also very eye-opening about implants and what we need to know in taking care of these patients. So the other thing that we'll use is this technology. We were talking about technology earlier, and particularly, man, I love the milling, how you can whip something out and just, literally a couple of hours, you can have something. And then on the other side of the coin, the scanners, your ability to use lasers. Can you use lasers here? In some. So when you get to those levels where you can use those kind of technologies, it makes your life so much easier and your patient's health is better because of it. And then staffing is a problem. That's a big problem. And you guys might have experienced it yourself, but staffing is an issue. And you guys get burned out. You need new things. You need new ways of doing things to help you stimulate yourselves. And also you need good teams. You need good people to work with you and be your support system. So staffing has become a real challenge in a lot of the areas today. That makes it hard for us sometimes to continue to implement new things in our practice. So let's talk about the first topic tonight. man, I love this kind of stuff because salivary diagnostic testing is crazy, crazy interesting what you can find. Back in the day, we used to take a sample of, I didn't have those, of course, remember who I worked for. We have everything known to man. It was a monitor and you took a little, it's like a microscope and you take a little plaque off the tube and put it under the microscope. Didn't you ever do that? You want to fix somebody's periodontal disease, do that. Crazy. They see spirochetes, they see whole rods, they see amoeba leaping around. And they thought you poked them and made them bleed. Oh, when we heard that. So salivary diagnostic testing is going to be another very, very important piece, I think, of our puzzle. Because what we've been doing in dentistry is we've been treating to a model of care that you assume there's certain bacteria present in the oral cavity causing this disease, causing these problems. You're assuming it's certain strains and you are treating with a model that has been developed to help assist you in killing those off. What we're finding is that there are some pathogens that actually are resistant to that antibiotic. And so what do you do then? So this is why I think salivary diagnostic testing is going to be on the forefront. I might have asked this, how many are doing it? Anybody? Gonna be good. You're gonna see something really fun. I love it. So I want you to take out your paper and I want you to write down I want you to think about this for a minute. What is the number one thing that from a system, just say system right now, in your office, number one challenge, write it down. What's your number one challenge? If you don't have a pen, use your phone. I know you all have your phones, and I know we have a little notepads. And so I want you to think about this for a minute. What's your biggest challenge in your dental practice today as a practicing hygienist? Or if you're here as a team member, what's your biggest challenge from a system standpoint? Then I want you to write down your number one challenge from a healthcare standpoint. What gets you frustrated when it comes to patient care? I want you to write it down. I want you to think about this. So when I ask people, tell me just if anybody wants to share, what's your number one frustration? It's almost the same all across the board when I ask questions. With systems, what's your number one challenge or things that you wish could be different? Anybody want to share?
You mean like scheduling?
That's a good one. What else? You want to hear what everybody else does? And I think it's in your head. Time. I wish I had more time. I wish I had a different.
Which is scheduling.
Which is. You get from.
Okay. Don't tell Dr.
You got it. We're saving here. Like Vegas.
There's some lady in here talking about time management.
Quick.
I love it.
Compliance, I don't know if they said over here, patient compliance.
Well, that's
Compliance, awesome.
kind of, yeah.
Oh, thank you, guys. So that is the hardest part is compliance, because what frustrates most hygienists is two really important things. Time management, being able to have enough time, not being forced in a model that doesn't allow you to really dig deep into your patient and really understand their disease and do all the things you'd like to do with them. And then patient compliance, because they come back and they look the same way they did when they saw me, right? They say they did everything right. They still look the same. But tonight I'm going to show you where we can throw a wrench in this whole thing and find out what's really going on. So salivary diagnostic testing was developed a long time ago, over 25, I think it's been 25 years ago. Dr. Tom Neighbor, such a crazy smart guy. He said, look, you know what? They're doing everything right. Why do they still look this way? Why are they losing bones? They're doing the water picking, the brushing, you give them 20 things to do and they're trying and they still look the same way. So what salivary diagnostic testing can do for you is it can show them their disease in a way they've never seen it before. It is a test like blood work that we go and we get our blood checked and okay, quit eating all the crapola because your blood cholesterol is really high or your A1C is off because what have you been eating? How do we know that? How do we know that? You get a test. And you can determine how well you do when you stop eating all the crapola. I probably shouldn't say that because we're recording this. Guess it doesn't matter. So this is really going to help you achieve successful remission state of your patient by doing this. It also helps you monitor the activity of the disease and the success of your therapy. So you could be treating and treating and treating and treating and nothing really changes. You ask yourself why. So this can actually help you monitor that. It also helps you to provide a higher standard of care. And most offices introduce salivary diagnostic testing by introducing to the patient at the visit, today we're going to do something new. We've learned that there is a test that we can finally be able to show you in a real test what this is going on all along. And all it requires is for you to sit. And that's it. No poking. No poking because you've made me bleed. Nope, we're just going to have them spit. And it's intriguing what comes up on these tests. And it really is, as healthcare providers, you're actually going to really discover you can save some of these patients' lives because of what's going on and all of the risk factors. So you really want to make sure that you understand what you're testing and what are your ability to treat to that level. What is it? What can you treat with what medicaments when it comes to that particular bacteria? So again, I like research and I like science, and I think we always go back and we start to get so busy, we kind of forget that you are healthcare providers. And so we all know that 80% of the population has some form of gum disease. Whether it's in the very early stages, like 80% of it. And I always ask my background, I was sharing with you, with that little dental assistant, but I didn't tell you the rest of the story. I have been involved with teaching hygiene, postgraduate training courses. I taught dental assisting. I ran multi-million-dollar offices. I was a consultant for other offices to share what I learned. I really actually went to see this work. And I've done all those things. And that came from that one little idea that this was so intriguing and interesting to me that we should move on and evolve in our careers. So I knew this a long time ago. They've been talking about it forever, 80%. But I go in as a consultant and I would pull data, particularly those crazy insurance codes, to see what are we doing here? What are we treating? And I know you all. You're good people and you're good hygienists. And you take that scaler and you take that piezo and you're in a pro feed and you're going to town because you know it makes a difference. Because 80% of your patients have some form of gut disease. So what does that mean then? What happens when you don't treat it? Or when you only treat to a certain level and the patient's not getting better? So 50% have heart attacks and strokes are triggered by oral pathogens. You think your patients know this? I'd have this blown up and put right on my, do you remember, do you guys still have mirror, like lights, or do you now just wear headlights, like you're going into a cave?
Both.
And now you have wonderful microscopes. You guys all wear loops. Loops, hard to go back. You know, the loops are incredible. It's like when your parents had that magnifying glass and you go out and burn leaves. It's like you see things that you cannot see with your eyes, right? It makes your life easier. I plaster this everywhere. I make sure that your patients are very aware that oral pathogens, we know this now, are directly related to heart attacks and strokes. My friend, does anybody know Laura Hooper? If you don't, you should write that down, look her up. She's an amazing hygienist. She actually works with the Heart Attack and Stroke Prevention Center as a hygienist. Cardiology and hygiene. They're saving lives and they're preventing strokes because they know these pathogens. Do anybody have ever heard of Anne Rice? She's one of you. Anne Rice is doing tremendous value to your profession on the 70% of Alzheimer's. She is deeply embedded in that research. And she talks about this all over the country, that 70% of your Alzheimer's disease patients are more likely to have suffered from gum disease for at least 10 years. Isn't that crazy? And then I love stories, so I'm sorry if I told you tonight, but my dad is 94 years old. And he finally had to go to his assisted living facility. He's got 5 teeth. And he is a hoot, but he's kind of going downhill. And they don't brush his teeth. They don't help him brush his teeth. It's a biological cesspool. And all that's going into his bloodstream, all of that is creating havoc. It's one of the most, to me, the nursing homes, and if we went in with salivary diagnostic testing and tested these folks, they'd be off the chain with so much bad bacteria. It makes them sick. So that's why we have to pay very, very close attention to what we're dealing with here now in dentistry, because we know 70% of that in Alzheimer's patients are plaque, strep mutans in the brain. We never thought that could occur, but we need science to prove it. And 7 times more of a pregnancy issue when you have oral pathogens that are not treated before pregnancy. So if you have patients who would really like to get pregnant and they're talking about it, it's vital that they take very good care of their oral cavity during this time. 12% premature death in women who have a history of periodontal disease. We have up to 50% greater risk for developing cancer. And not just, oh my gosh, you guys, is anybody doing any kind of oral cancer screening on every patient every time? We should be. Look, you're just screening, you're looking, and there's some great tools out there to help you with this. But if we were testing their saliva, we may be able to catch some things a little earlier than we ever thought of, because salivary diagnostic testing can actually also include HPV. And so we know that's directly related to oral cancer lesions. I have a great friend, I can't tell you, at least 3 doctors now, dentists, oral pharyngeal cancer, not smokers. They might tip a cocktail every now and then, but not heavy drinkers, any of those things that could be related to it. So we need to pay very close attention to this. And then 95% of your diabetics, 95%, it really messes up their A1C. They're the toughest in the crowd, right? Keep treating and keep them healthy. So this is why you really have to consider, we need to start thinking a deeper dive. So one of my favorite tests, and by the way, there's no affiliation with these companies, I'm just kind of a nerd about stuff like this. And so this is the 5 red pathogens. This is what a particular test that I really like is called HR5. It's by Direct Diagnostics. And they'll even, at one point, and I don't know if they still do this, but if you call them up, they may do some free testing on you guys. Be shocked at what's in there. We think we're so good, you know, we think we're so good. But it really just, we discover a lot from that. So these are the 5 pathogens that we should be very, very concerned about. When you look at my screen, you'll see AA, you're all very familiar with that, but it is the primary cause of rapid alveolar bone loss in children as well as adults. When grandma comes up and walks lips with babies, blubber all over them, kissing their mouth, I'm like, what's going into that baby? Oh. So we have to be aware of this. It's also really related to the risk of cardiovascular disease. Cardiovascular disease is super important in our world because we are taking blood pressure to detect stuff for high blood pressure, but we're also concerned because these pathogens do cross the bloodstream, they get into your heart, your lungs, all these areas. So we want to pay attention to that. PG is another primary cause of bone loss. CD is really interesting because it's very much associated with implant failure. A friend of mine, and I wish I had a picture of him, you guys would love this guy. He is a musician. I live in Nashville. You can tell I'm not from there. But you could tell probably where I'm from originally if I say Chicago, because I have that. But when I stay in Nashville for a little long time, what happens is I start saying, y'all want to come over? Y'all. I love it. They're some of the nicest people in the world. But anyway, he's a friend and his teeth were awful. He'd never taken care of himself. Touring musician, played all over. He's like, I just don't want dentures. Just don't want dentures. So he went through the process. Long story short, he was doing everything right. He quit smoking and he was doing everything right. 2 implants failed 2 times. So why? Why would they not integrate? What was going on? That would not allow that foreign, they are foreign objects, by the way, that we're putting into bone. So very interesting if we tested him what his pathogens would look like. That TB is very instrumental in implant failure. The primary cause of with DF is also implant failure, and it affects your health issues. We're still not clear exactly what that one's doing to the rest of your body, but here's the one that's the biggest culprit is FN. It's your inflammatory factors. It carries that particular pathogen will help move pathogens through the bloodstream. It's also a very inflammatory marker. I used to run. I wish I could run again. I love running. It makes it great runners. It's euphoria. And you're like, you're going out the door, you're like, I don't want to do this. I don't want to do this. I don't want to do this. And then, oh, I kind of like doing it, right? And then you're like, I can do anything. And then what happens is that, you know, like your knees get shot, your hips get shot, and you can't run anymore. So you have to find some other things to do. These pathogens should be tested on all your patients who exhibit any form of gum disease, particularly your people who are going into bone surgery, implants, particularly implants. We need to know what we're diving into when you're doing the surgery. We are the only profession that does surgery without testing our patients. We're not going to do that anymore. We're going to start testing them. Some very important things I'm going to talk to you about here in just a little bit. And these pathogens could make or break the case. It could actually help you identify people who are at very high risk of implant failure, like my friend, who desperately did not want a denture. But he ended up with a couple of implants. Lower worked, okay, but the upper didn't work. So now he's faced with having to wear a denture because there's really not a lot else they can do for him. Because once an implant fails, if there's some sort of percentage, it's super high, we're probably gonna fail again. And they're looking again at the science. Hey, why would this be happening? So you're going to identify the species, you're going to have an outlined protocol, and you're also going to give your patients a way to finally see their disease, just like our little microscope did. I have a friend in, he's in Pittsburgh. I swear, and I swear his TVs were this big in his room. They were huge. I've never seen anything like that in my life. I said, "Dude, with the screen." It was massive. Every room had it because he sampled every patient on their new patient visit, and they got their bacteria up on that big screen floating around right in front of their face. He said, "Do you want to watch people change really quickly?" You look at like, okay, you're supposed to have maybe 10 of those floating around. You got about 5,000. So it was really interesting the way he approached and let them see their disease in a different way that we've been pretty much trained to do, is just tell them, you got it. No, you poked me. No, you got some. No, you poked me. My gums have always left. My mom's gonna fuck. My dad, well, they probably were giving you all the bacteria right from their mouth to yours. So what you want to think about is if you are driving tests in your practice, this is not an expensive procedure. If anybody has had blood work at a lab, you're talking $150 to $600. These tests are about $65. And what a wealth of knowledge you can walk away with on how you can help the patient. So it helps you to also give a medical diagnosis to the patient to how to treat them. It's also really important, as I mentioned, with restorative care, because I can guarantee you our doctors do not want to have to take an implant out. Neither does your patient. It's traumatic. It's like emotionally traumatic. You're going to be great at taking care of the pain levels, but we want to make sure that they're okay. It's also really, really critical now that we know what we know about overall systemic health and making sure that we're taking care of everybody in a way that we can maybe prevent some heart attacks and strokes and dementia and all of the things that these bacteria can support negatively in our bodies. It really is great for your practice to set you apart. It makes you different. Today, your level of competition is crazy as a practice. How many of you work in private practices? And the rest of you are in some level of groups? This is what we're up against, is that we want our practice to stand out and be unique and different and provide the patient with cutting edge technology and cutting edge services. So let's look at how we're going to fit. This is how easy it is. So these are the HR5 tests I'm going to show you first, and then I'm going to show you, anybody heard of oral DNA? Yeah. So we'll talk about what some of the differences between the two are. So this one is the HR5, 5 red bacteria. And by the way, what makes them different is they're very highly sensitive tests. It's going to pick up stuff that other tests don't. It's really sensitive to it. That makes it really good to pick it up early. So all you have to do is, you see this little thing here, you just fit in it up to about, it doesn't take much. Now you're saying, yeah, Debbie, but what about my patient who literally has no life? What do? If you get a piece of ortho wax and you have them kind of roll it around for a little bit and chew on it, it actually stimulates a little bit, enough saliva to get it, just enough to get it in there. Once you did that, then you seal the container, and then you basically, they have a FedEx label that you just put it in a little box and send it on its way. 2 days later, at the latest, sometimes they're even faster, you're going to get a report, and it's going to come through a secured HIPAA portal. So it'll come electronically to you, and you're going to get to see what was going on in that oral cavity. And this is what it looks like. This is their test. What you'll notice is that they ask them to fill out a very brief medical history. So they have background on whether they have any of these disease factors. And what I love about this is that you can literally see what each of the pathogens are and what they do. And these pathogens, there's an explanation with them as well. And having an explanation, your patients get a copy of that. So now you just didn't poke them. They just didn't bleed because grandma always bleeds. They have a real test that shows them what's been going on. So in this test, you'll notice that there are AA and PG were not detected, but there were moderate levels of TD and TF. But, ooh, doggy, that's FN is risk high. That's inflammation. And inflammation is directly tied to most diseases. So you control inflammation, you control disease, and you control pain, especially. Remember, I was telling the story about how you ran and, you know, like a bear, you can walk up the stairs sometimes, oh, you know, and that inflammation factor is part of the problem. As you age, you lose collagen. And you try to put a little collagen back in you and try to get that supported again. This is the test that can tell them what exactly is the disease process bacteria that's going on, how do we treat it? So they get a nice report, they get to understand what's in it, and they also, your doctor gets an explanation of what particular medications and antibiotics are appropriate for that particular pathogen. And it gives you a first, a second, and a third. People are allergic to certain things, so you don't want to give them something they're allergic to. So this test, this HR5 from Direct Diagnostic, will give you everything you need to treat those specific pathogens. And then the magic is you go through your scaling root cleaning, you go through your process with your patient, and you retest them. After you've done all the things you're going to do, you retest them. And when you retest them, you get to see all over again, how well did we do? How did our patient do? Are these flattened? Are they no longer present? Are they lower? And then we can applaud our patient for the work that they did to help achieve that. And this is why I love this kind of test, because it really gives you a roadmap of being able to understand what to do. So here's the second test that we're going to give our patients options. There's always options. There's more than these two tests, by the way, but these are the ones I know the most about. But before we talk about that, how many people here have ever used a Gracie scared? So everybody gets candy. I think I have enough. The other room needs some candy though. We give them candy to the other room.
I did earlier.
Okay, let's give them some more. We can actually.
Okay.
So, how many of you have mentioned that you've been around the block for a little bit? Who's the youngest hygienist in this group? Who's just been out like less than a year? Anybody? Oh, seasoned. So how about 1 year, 2 years? Oh, well, congratulations. You made it. Very different from school, right? So let's give you, you're going to get one. We'll give you one of these. This is, by the way, when the pandemic hit, I call it the C19 years. This is the world's best hand sanitizer. Well, you guys are killing your hands. I was frustrated. I'll digress for a moment. I was frustrated because you guys always done a great job of protecting patients and yourself. Always been around these viruses, right? And when that happened, I was like, this is nothing. Anyway, we had to do what we had to do. But everybody was killing themselves with these awful hand sanitizers. They bought them, and the FDA got rid of a bunch of them because they were so toxic. Were bad. Smelled like tequila at 3 o'clock in the afternoon. Patients are going, what's going on? Well, tequila. Have you been drinking again? So we made a crazy good hand sanitizer. It smells like a spa. Makes your hands soft. The technology that we use, I'm going to share with you about Cello Life and why I got so excited about it. It's so intriguing and how it works, but it's the same technology on how we actually made this for you guys. So let's talk about the oral DNA test and why it's different. So what they did is this was the original brainchild. This is one of the first ones that came out. And what the goal was to test bacteria, but then it became evolved into you could test for viruses, but you could also test for a gene that you can carry. I think I should have bought two. It's so enticing. That can't be so fun this Sunday. And I know you guys like it. I told everybody that comes on our team, just bring them candy. Don't think that they don't want it in that dental office. They love it. So what oral DNA did differently is they have can test the gene. You could all get your little spit test and you could find out if you carry the gene that patients carry to encourage periodontal disease, you could test it with simple saliva. They also, with the HPV, were really pushing this about 20 years ago. And a lot of offices were really concerned about even talking about HPV with their patients. Understandably, it's kind of the idea of it is not such a great idea. But today, we have the most rapid rise in oral cancer in 30-something than we've ever seen in the history of dentistry. We're seeing people with tongue cancer, tonsillar cancer. It's just awful what they go through, and they're not even smokers. And so this is why I asked you earlier, if you do me one thing, you go back and do one thing, read up and reevaluate and do your screening. It takes less than a minute to look under the tongue, look at the back of the throat, palpate, do that because it's on the rise like we've never seen before. But people like this can test for it if we have concerns. We also, this is a little different. You switch with a substance and kind of gargle with it, and then you set it into the container. It's also sent away, and then you get the same kind of reporting done from their system, just like you would from HR5. It'll come through the portal, available usually within a couple of days. And you're going to get measurements of different bacteria levels. And you'll notice they measure a little differently and they look at different things. So when Dr. Neighbors came up with this company years ago, his mission was to help people get more into remission state with periodontal disease. He wanted to see if we could find a way to stop the bone loss and stop the types of presence of disease that he was seeing in his practice. And that's how it was born. So this is really similar in a lot of ways, but different. You can order supplies online at their company and they'll send them directly to your office. And then you can log in and look at the reports anytime. And what I also like about this one, you guys, is that they can send it to their homes. So when you have a patient that may not be able to get out easily, or maybe somebody who is limited on their availability to get to your office, you can actually anytime just send it to them and they can fill it out, spit into it, and then send it off and you're going to get a report. So out of that report, we talked about these 5 red pathogens are very instrumental in causing a lot of problems, especially restoratively as well as periodontally. But I want you to all really put this into your head. This is an inflammatory disease. We've been talking about gum disease, and we say you have gum disease. And the community at large is more like, okay, you know, my parents had gum disease, you know, no big deal. We've kind of done it to ourselves. This is an inflammatory infection, and that's why their gums bleed, not because you poke, and not because they brush their teeth either. So it is specific groups of pathogens that are causing this chronic, long-term bacteriological disease. And we need to get serious with our patients because this is what it is. And I think they just have not been really well educated in our community. Not our community, but in the world as a whole. It's just made to believe that you can have dentures, it's fine. You can have implants, now it's fine. Your teeth are never better. Your teeth are always the best. Your natural teeth are always the best. So we want to save them and we want to try to keep them as long as we can. The other thing that you understand about this is the complex genetic disease. Why do you see this in generation after generation after generation? And it's definitely tied to genetics. So we also know that it's not their fault necessarily, it's just they have the gene. And so the influence of the environment, I was checking in my hotel and this young girl at the front, I could already tell she has gingivitis. On the airplane, I carry Stella like with me, I spray it in time. I travel all the time. I'm like, I've probably got the iron. I'm like you guys, I got the iron immunities because you're around it so much, right? So I'm on the airplane half the time, I'm like, oh. And so I'm looking at this girl and she's behind, sweetest thing. And she's like, what are you doing here in the city? And so I said, oh, I want to talk to the dentist and we're going to have a great time and we're going to learn a lot of new stuff. And she goes, what could I do? What can I do? And I said, well, I think there's two things you could do. Quit sucking on that sweet tea all day long. That's one thing you could do. And then I want you to think about having a doctor do a salivary diagnostic. So I need to see what bacteria you really have in there and how you can treat it. So she was pretty excited, not so much about the sweet tea, but she was young. She didn't understand acidity, didn't understand that bacteria was causing, not just because she didn't brush 3 times a day. We have patients, right, that brush once a week sometimes. You're like, oh, do you not have more disease? They have ironclad bodies. These are like one more story. My mother-in-law, she's alive too, 94. She drank for 40 years, 3 Manhattans every night. She smoked at least a pack of cigarettes every day for 40 years. She's 94 and there's nothing wrong with her. Nothing. She doesn't have COPD. She does not have any liver issues. It's like, that is crazy. So there are people out there in your world that are like that. I brush my teeth once a week, I'm fine. And they are. It's crazy. They're one of the lucky ones, right? So getting back to our topic about the reasons for us to think about testing and using it as a tool, like your Cavitrons, like your piezo, to solve a problem, we need to think about the model of the cause, root cause. I want you to start thinking root cause. We're topical. We've been topical for years, but I want you to start thinking, where does it come from? Where does it come from? So we know that smoking is a big deal. Do you have smokers in your practice these days? Do you guys see a lot? I mean, they always say they're coming in for an implant or coming in, they've been out in the car. I quit smoking and reeking. I quit smoking 20 minutes ago. Their diet plays a huge role in this. Do you know how bad food is? Our food is not what it used to be. When I grew up, I'm one of 10 children I know who was traumatized. 7 girls, can you imagine? 7 girls and 3 boys. My mom and dad were married for almost 65 years. And we grew up organic. I always tell the story about Arnold the pig. The neighbor down the road, I lived in Illinois, and the neighbor down the road really liked my dad. And my dad was a fantastic carpenter. I mean, he could build anything. And he wanted a smokehouse because the farmer had cows and pigs and all that stuff. And so my dad built an amazing smokehouse and wouldn't take any money for it. He just wanted to do it, I think, to see if he could do it. And so the farmer would bring down what they call, do you know what the runt of the litter is? It's the tiny one that's probably not going to survive, right? Never seen a tiny baby pig. And I mean, this pig was literally probably 6 inches long. And so he brought the pig down and he said, now kids, it's probably not going to make it. But you can play with it and feed it and take care of it for as long as it's alive. The thing was 250 pounds. We did eat Arnold. We knew we were going to. We were always told we were that part of our food source, right? You got 10 kids to feed. So this was really an interesting time because we were eating really clean food. Think about it, little Arnold. He was out there like trotting around. You call him and he knew that, his name. I know, we ate him, but it was like, it was one of those things. And we see these scraps like pieces of ends of carrots and lots of vegetables. And they roam the ground, eat the bugs and all that stuff, the chickens and all that. And so the diet we grew up on was very different than our diets today. Those were clean foods. Those were foods that weren't genetically modified. They were foods that weren't full of sugar. We're the biggest sugar consumers in the world. It's in everything. And sugar really doesn't necessarily cause as much cavities as we always thought, but it's really bad on our body, on the inside. So diet is really important. And one of the simple things you can do for your patient is give them some advice, one or two things that could help them with their K2 level. Vitamin E, we're very deficient in vitamin D. It's like 85% of our room here does not have enough D, not even close. The average person in the US has 10. You're supposed to have 40 when you check the blood. Why? We wear sunscreen, blocks the sun. Sun helps us produce D. We don't drink milk like we used to that was vitamin fortified. I hated milk like that. And we are not eating enough fresh vegetables. Green leafy things have lots of K2 like spinach. Our kids aren't eating like that. I loved McDonald's too when I was a kid. It was different then though. It was real hamburgers, real hamburgers. So you have to think about this. You have this subject in front of you, a host, and you're looking at them and you're going, wow, we got a lot of work to do. We need dietary changes. We need a realization about the disease process. We need to guide them and help them. So you aren't just teeth cleaners. You're doing a lot more. You're also going to understand that the disease is part of fungal, yeast, viruses, pathogenic bacteria. This picture alone, I think, is really good for our patients to see that it's not just because you didn't brush your teeth. All these things come into play because you are a host, and you are a host to a lot of things that are rolling around in your body. So we really, really want to make sure we know what we're dealing with. So this is the alert to my Peri-Implantitis. This is the way it looks when you get it from oral DNA. And this again breaks it down for you into the high-risk pathogens in their test. Again, giving you all the information you need to treat those pathogens. But you also see that there's markers and there's also a low-risk pathogen. I remember seeing a patient that came in and really bleeding a lot. And we did the salivary diagnostic testing on the patient. And it came back that their markers were not really above normal. Their markers were like really close to being below normal, like in the right range, but they were bleeding profusely. Why? Their immune system was so shot, they couldn't even handle that small amount. Not even the small amount of bacteria floating around in there. So a patient like that, you really got to figure out how to clear those pathogens for them so their immune system can take over and really do a good job at helping them stay healthy. So interesting, isn't it? You could have all this come back like that, but you still have obviously symptoms. So that means we got to get to the root cause. This is what oral DNA looks like. And it's really easy. They do provide a solution. So if you do have more of a population with dry mouth, this is actually kind of nice for them because it's hard for them to get in play. So let's take a look at the heart attack and stroke side of it. Why would we want to know about this? So Laura Hooper and her team, have anybody heard of AOSH before? American Academy of Oral Systemic Health. If you ever get a chance to go, you should go. And the reason why is that their whole mission was to bring medical doctors, talk to the dental community, and the dental community talk to the doctors and work together to help heal your patients. And what's interesting about that group is that they had a really neat guy that came, an MD came and spoke, and he had written a book about how you can reverse Alzheimer's. And he worked with a Harvard professor on this. And what he found was diet was 85% of the changes. And when I say reverse, I mean, if you have a person in your life that is a 9 on the scale of 1 to 10, pretty bad with Alzheimer's, they could get them back to an 8. So that means that they're getting back some of their cognitive skills that they lost. When you're a 4, they can get them to 2 and even 1 and really repress their symptoms of their Alzheimer's disease. So this is what AOSH is all about. It's really interesting. You get to hear that side of it. As clinicians, you get a chance to make a real difference in some of your patients' lives. And that's really interesting. Have you ever had a patient in your chair and then they end up next day having, like, you heard they're in the hospital? I know, that's happened. And you're like, oh, what happened? Well, their disease long running, they haven't been to the doctor for a while, and they haven't, had these tests done, and all along they've had these disease process going on. So when they looked at this Alzheimer patient in this study, they actually found that over 19 oral bacteria were associated with diagnosis of Alzheimer's and any kind of dementia. And as you see, the Procomoralis gingivalis is the most common culprit. And you'll notice that there's a lot of really intriguing evidence that if we catch these things early enough, we really could possibly prevent some of those really horrific side effects of Alzheimer's disease by repressing it and keeping it from getting as bad as it could be. So all those poor little patients in the nursing homes that have a ton of bacteria in their oral cavity are just getting worse and worse because they have these pathogens that aren't being treated. They're infected. And I always was fascinated too. You guys know that a denture, acrylic denture, harbors over 25, I think I remember, 25 type. I should have asked. 25 different types of bacteria live in the denture. So think of grandma, and she's wearing her denture, and she's got C. diff. She gets real sick. She goes to the hospital. They take her denture out. What do they do with the denture? Yeah, well, I'll give you a gel for that. They do lose them. Somebody else is wearing them.
In a container.
They put them in a container. I'm giving you guys a couple of prizes here. So they put them in a container full of water. And then the patient gets better. What do they do after that? They take them out, and sometimes don't even rinse them off, and slip them back into the oral cavity. What did they just do? They just reintroduced whatever was living in there in a very vulnerable host. So it's really important for us to even think about those things when your patients are sick. Remember we tell everybody throw away your toothbrush after you've been really sick? And or we put it, do you guys remember weren't those little ultraviolet things you could stick your toothbrush in? So we need to think about this and educating our patients. It'd be interesting to see what a test would look like on a patient like that. But we also need to think about on the nutrition side, what can we do? So are you all familiar with antioxidants? You probably know, you probably have them in your bodies because you've been eating good things. or you take them as a supplementation. So antioxidants are really, really important because they reverse the damage done by oxidation. Oxidation, you're all oxidizing. We're all sitting here getting a little, we need oxygen to survive, but yet it has a side effect. We actually are breaking down. That's how we get older. You figure out that, you're gonna be worth $1 billion. How to quit oxidizing. So what happens with antioxidants is that they help you repair free radicals. Free radicals are the neutrons that are missing from cells. So when you eat good things, it repairs those. And it makes you less vulnerable to disease, cancer, all kinds of things. So even though we need oxygen and we're oxidizing, we can re-support our system by providing good antioxidants. People who smoke have a huge risk, and vitamin E deficiency, huge, because they are constantly doing this motion of presenting the lungs and the oral cavity with the smoke, and it's destroying and making everything so vulnerable because there is a problem with their neutron. And I'm going to show you what that looks like. So reactive nitrogen species are really important because there's a big push right now in the dental community as well as the medical community about nitric oxide. I want you to write it down and look it up, do a little nerd, ask Dr. Google. Ask him. I always think Google's a man for some reason. I don't know why. Could be a lady, I don't know. And when you ask Dr. Google, look up nitric oxide, because nitric oxide is super critical for our cardiovascular health. And again, when you test, there's a little strip. It's almost like anybody have pools that you use, you know, the little substitute strip in the pool, something like that. And you can really measure your nitric oxide. And so having these particular types of food support systems is really easy for your patients to help themselves by just thinking baby steps. Don't give them too much all at once. Just ask them a couple questions. First of all, did you know that your cells are more vulnerable because every day, everything we put in our bodies, everything we're doing, we're wanting to oxidize, it can damage inside what we have naturally good support systems for. Our bodies are miracles, really, the things we put them through, it's like crazy. So here's what it looks like when you repair. You take an antioxidant with all those little neutrons and they electrically donate it to the vulnerable free radical. That repairs cells. So the more things you eat, the more things you think about that are antioxidants will continue to repair those tissues through repairing those free radicals. So here's the simple part. Good old bananas. So did you know the banana is the, okay, wait a minute, I'll give a prize. I won't say the answer. Okay, who knows why you should eat a banana when it's more green than when it's more brown? Sugar? What, I'm sorry. You're both right. I'm gonna give you one. You're correct. It's sugar. When you let a banana get to that stage, it's actually causing you to have higher blood sugar and then causing a little bit more aggressive blood sugar levels and harder for your body to manage that, so digesting. So these bananas that you get at the store, you want to make sure it's clean. There's so many places we buy our fruits and vegetables from that you really don't know what they were sprayed with, and it lives on their outside and sometimes on the inside. So if you can, you find something that's cleaner. So a banana that's about at the stage where it hasn't turned brown, it's still pretty firm, the ideal time. You want to eat them during that time frame. I used to love the brown, but I don't know why. The brown was just, I don't know, I don't know, I was a weird kid, I guess, I don't know. But that is not the best time for us to eat it because we lose, not only is it like a sugar bomb, it's the same with grapes. If you like, yeah, what are the green grapes? Those are like sugar bombs. Purple grapes, because I like wine, I want to believe that those are better. And there's some funny comments, yeah. Yeah. Well, we need to think about those polyphenols, that's what I'm gonna say when I get a good glass of wine. So these are really interesting, types of sources for patients, very inexpensive, very easy to do. And they actually deactivate some of the periopathogens. Getting back to really, really good food sources could be a huge help to your patients. It's simple. I want you to get back and think about when you were, and maybe not today's kids, but I was going to say, think about when you were a kid because Domino's Pizza wasn't around. And think about in really putting back the nutrition again to help with these periopathogens. And they actually have preventative effects against oral cancer. There's some really, really interesting, when I share with you about cellulite, the reason we put some of the things we did in our rinses is because of what they can do in medicine. It's brilliant. It's really fascinating what they can do. And so we really want to really look at this. We want to think about what can we do to help promote healing. If I could have had enough time, I would have shown you some pictures of peri-implantitis cases, and I'm going to show you a little bit, but diabetic ulcers, a toe, I was a toe where they were going to have to lop this toe off, but they used PRF and made a membrane and put it on the toe, and this woman's toe in 30 days was healed. And it was simply taking PRF and a membrane and slapping it over the top of it. She had cancer on her toes. She was in the sun a lot, lived in Florida. I want to show you that picture. So gross, but it's cool at the same time. So this is where we're gonna talk a little bit about what's happening with all these implant patients. So now you know about diagnostic testing. My recommendation to you all before you do perioscaling and root plating, please consider it. Maybe test the waters, do a few patients, see what happens. Also for your doctors who are doing implants in these kind of surgeries where you're actually putting a foreign object into the bone, you really want to know what you're up against before you do that. It's really easy for us to look at an x-ray and have a diagnosis and say, we could do this. But what about the environment? Think about building a house on a beach. How far do you have to go in to put the pylons down to make it stable? So you have to think about your environment and what you're trying to achieve and what are you dealing with environmentally to be able to get to the end result. So did you know that implants actually are very sensitive? And we really didn't know this until recently with a lot of the research that's been going on about why there are so many failures in regular patients that don't smoke. So it's really important to understand it's inflammatory, and there's two types. You have the mucositis, which is for the gum, and then you have the peri-implantitis, which is the bone. So when you're thinking about periodontal disease and peri-implantitis, we consider two things. We want to look at these patients in a way a little differently than we would with natural teeth. So there is still bacteria that's around those, still causing damage. And I always thought it was kind of funny because it's always interesting because you get so excited about helping these patients and doing implants and other things. And yet we're also should be thinking about, is it going to last 5 years? Is it going to last 10? Can we get it to 20? Because that's what we really all want, is we want these patients to be able to have these things and last for a really long time. Does anybody have an implant? Anybody have one? 1, 2, 3, 4, yeah, implants. So it's kind of a big deal. I mean, you're thinking about it and you're thinking, this is surgery and, it's something that I want to make sure lasts for a long time. I don't really want to go through that again. Like other things that we have in our life that we don't really want to do twice. So here's an example. Doesn't look so bad, except for a couple things you notice. What do you notice when you look at that visual, not the x-ray, but the tooth and the tissue around it? What do you see? You might want to share. Our other room has been quiet. I haven't heard any questions from them.
The tissue is shiny instead of stipple.
Yeah. See the difference there? It looks odd. It's not quite the same as the nice, pretty, supple looking tissue. So we know we've got something might be happening. So you can see in the x-ray. What do you see in the x-ray?
Loss, maybe some cement.
Bone loss. You see anything else? You see any buildup?
Yeah, so if it's cement or calculus.
Could be, but that's very irritating, right? If we leave any cement behind. Do you notice about this is that if you can sort of see it. I think you'll be able to see it better here in just a second. But what you'll notice is that with implants, their surface structure is very delicate. More than we ever imagined. We thought it's titanium. I live in Nashville, I mentioned, and we're really bad this year. Like, football is my thing. I love football. And I keep thinking, don't leave Derrick Henry, don't leave.
Panthers are worse, so.
One of those years for all of us. So when we look at implants and signs of peri-implantitis, you need to be looking for similar things we would see in natural teeth, except there might be some exceptions to this rule. You're going to see possibly some pus. You're going to see bleeding without any kind of brushing pain. Some people experience pain. I was talking to a couple of implant doctors just last week, and they were saying, the odds of an implant failing are almost 90% if patients have pain after implant or over a period of time. It should be not like that. It should be better and better. So it's kind of one of your first signs something's going wrong for many reasons. So we want to look at this and we want to use our tools to be able to understand what's happening. And here's what it looks like when you look at a real tooth versus an implant. But one of the things I wanted you to really notice about this implant is if you look at an implant, whether it's ceramic or titanium, it's literally like a screw, right? It has those little rivets around it, and it was designed that way to be able to have the bone integrate into that to help hold it in. Now, back in the old days, when we had the blade implant, you didn't have that. It looked like a razor blade. It was crazy. And so we hoped that they had look like cheese where it has little holes in it. Blade implanted bone would grow between those little holes. We evolved into these kind of implants today. So here's your problem. Those little rivets, if they're exposed above the gum line, really attract a lot. They really, really attract a lot of pests. And this is where you might not like me here in just a little bit. Part of the problem we're seeing with implants and peri-implantitis is that we have a problem with titanium flaking off into the tissue like splinters. And my friend Giorgio Tsoutsakis, Periodontist, University of Texas, San Antonio, has done years of research on this. And he was very kind enough to share with me some of his research to share with you guys about why it is so important that we understand how to treat implants in the chair. And I think why you're not going to like me is what he's finding out what's happening in hygiene. So it's not your fault, by the way. not your fault. It's just we have not been properly trained on the level we should be to treat and cure for implants. They are very different than natural teeth, and they react differently to your instruments and the things you're using, medicaments, things you're using. So what he found was that with particularly scaling with titanium scalers is that even the finest, thinnest, smallest ones actually scratch the surface of the implant, creating this disruption of the titanium, and it infiltrates the tissue and causes this irritation, which then becomes peri-implantitis. So he's really focusing on helping us understand what we should be using and how it can help. One of the things he loves so much is he really loves water picks. And how many of you use water picks? Often. Have you heard of the Venturi effect? Do you know what, like tornado? Tornado comes in, remember how to, if you ever watch, deadly but fascinating to watch. You watch a tornado come down in the sky, it's swirling, swirling, swirling. Once it hits the ground, what? Things that come up. It starts to suck things up. That's the Venturi effect. Water picks do that. And so the debris that might be down in the focus, even without an implant, water picks are awesome to help really pull debris out and get those tissues stimulated and clean. And you don't have to use anything. You can just use good old water. And his research actually shows us too that they can distill biofilm with water picks. So how many of you use a Sonicare? Love my Sonny. I've had one of those forever. How about the Rotodent? You remember the road? You love your road. Do you still have one? I think they'll make them. I think they do.
They do too, yeah.
They do. The Rotodent, and it was rotational like our Instagram. And Sonicare came out. We got all excited. We love the Sonicare. And then Oral-B came out. I think it's the Oral-B water pick or water pick Sonic. So you can water pick and Sonic at the
Fusion,
water pick fusion. There you go. I mean, you can use your Sonicare and have a patient go through, and even if you have a possibility of having a support system where you can have them show you how to use it properly because they want to do this with it. And then you go back and do it again with a water pick Sonic. It shoots things out, you never know we're there. It's amazing. And so in my house, I have a Sonicare on one side and I love it. It's good. How does anybody not brush their teeth? I can't even go half a day. It's gross. It just feels gross. So one of the studies that'll be coming out on cell life here, probably at the beginning of the year, is coming out of Stony Brook University. The study was the 4 dental students. They had to not brush their teeth for a week. And what they did was they did salivary diagnostic testing prior to. They didn't brush their teeth, and then they retested their saliva to see when they used Cell Life Recovery Kit, which is a 3-part system, what would happen. It's exciting. I can't tell you, I have to kill you all. They told me I couldn't talk about it till it's published. It's ready, but it has to get published first. So you have to be very, very aware of the instruments you're using and your favorite rinse. I know you don't like it. We were all taught to use it. Chlorhexidine actually showed to have a dramatic effect on implant surfaces. It actually corrodes them. Now, I can't be sure this is true, but I'll tell it to you because Dr. Scott Fromm, a periodontist out of New York, brilliant guy. He did a lot of pilot studies, but he was teaching a course. He said, do you know who created chlorhexidine? Well, he said it was originally made to remove barnacles off the bottom of boats. Like, and then he said, And by the way, and again, we probably would fact check this because I'm not for sure. But he said the ADA never approved it for anything other than gingivitis therapy and for a short period of time. Interesting, isn't it? How we've evolved into using this really horrible kill agent, but it has these really, really rough side effects from it. So one of those side effects is how it affects implant surfaces. It actually does in fact cause corrosion, which then leads to the implant surface starting to corrode, and all those little pieces are floating off into the tissue. So we do not want to use chlorhexidine around implants. And I love this artist. I wish I could draw like. So Dr. Kataka's study showed that just the clinical concentration, the normal concentration, was also visibly affecting osteoblasts. So remember what your osteoblasts are? The cells that move. Oh, I got something for you. Marty back there, she's got her phone out. She's probably checking Dr. Google. So there you go. So what he found was that when you looked at chlorhexidine and these really important cells that grow bone and the cells that repair your tissues that you love to treat and heal, it kills fibroblasts. And that's your collagen moving cells. So whenever you touch a wound with chlorhexidine, there's a period of time where no osteoblasts will form and no fibroblasts will form. So we've been using this product because we were all taught to. We needed something different. It's a great kill agent, but again, it has these really tough side effects. It also really disrupts the ability for cells to adhere to the implant. So it's not uncommon for our surgeons to send patients home with chlorhexidine after surgery because they're so worried about them getting infection and the bad bacteria getting into the cells. So that's what we did with Cell Life. We figured out a way to be able to not kill those, but kill the bacteria you want to kill. The gel I'm giving you guys, by the way, that gel is crazy good. That is a gel that can be used for angular cheilitis. After periotherapy, it soothes, it is an antimicrobial, anti-inflammatory. It works for cold sores. It works for canker sores. It beat out lasers on treating canker sores. It's an incredible wound healing gel. And there are a lot of off-label uses that have been told to me that I can't share with you, but there's a lot of uses. So here's your real picture of what's happening with under the microscope. What you're looking at are scratch tests, and scratch tests are when they take a piece of tissue, cut it. That's the black part. Down at the bottom, you're seeing little tiny fibroblasts coming out. So this one over here is good old salt water. Salt water is really good, actually. Great antimicrobial, and it doesn't kill fibroblasts. The middle one, anybody want to take a guess? Chlorhexidine. You see no activity. Nothing's coming out because it kills it. It's a kill agent. It kills everything, including the good stuff. And the last one you see on the far side, that's Salivary. So here's what we did differently. We created an antimicrobial, anti-inflammatory, no-kill fibroblast, no staining product that patients can use every single day without toxicity. It heals in half the time. You see how the fibroblasts at the same time point are already meeting each other and they're coming together. And that's why the wounds just heal so fast, especially with our perio patients. We use this as an irrigation as well as to help increase the ability for it to heal. Here you see this little QR code up here. If you, I don't know if that'll work or not, but you could try it. It goes right to the study. So if you are really enjoying a nighttime read and you want to fall asleep pretty quick, pull the study up and read it from top to bottom. But here's the conclusion. Our product did not kill fibroblasts. Our product accelerated the healing because the fibroblasts love it. They think they're going to the best party in town. When the cell life hits it, they want to move, and they want to move really fast. So in periodontal therapy, peri-implantitis therapy, you need a product that's not going to kill those fibroblasts, but also you want something that's going to be able to be an antimicrobial to kill the bacteria off that you so desperately do not want around those sites. So my friend, anybody ever see Susan Wingrove? She's awesome. She's a hygienist, brilliant. She's manufactured and developed her own scaling tool. And on top of that, she has developed a medication. It's like, she keeps busy. But here's a couple of papers that she has in her program that she shared with me as well. So again, just reinforcing what we've known through other sciences, that it can really change the pH of the oral cavity dramatically, and it's really hard to get it back after use. Chlorhexidine can alter taste, not a great side effect. Can raise blood pressure, not a great side effect. So we've all been seeking something different and something we could use with our patients long term. This is also a fantastic study that came out about biofilm focused home care. And again, these are all, Susan is always happy to share with you her data. It's on her website. So she is the one that I think you need to get to know, because she also wrote an incredible book for you guys on how you can help your patients and treat these. So no toxicity to fibroblasts and no toxicity to osteoblasts. So here we have her book. It's on Amazon. She gives you blow by blow, step by step, really great visuals on how to care for the implant patient. What should you be using tool-wise? What should your home care look like for these patients? She has done a brilliant job of making it super easy and really, really easy to follow. And if you ever get a chance to have her come here or come anywhere near and you see her name, go see her. She's a fantastic person and she's really knowledgeable. But this book has been instrumental in helping hygienists because nobody's teaching us, right? Nobody's teaching how to do this on a hands-on course, and she will actually do that. We talked about water flossers, and what Dr. Patakis mentioned was that in his studies, it actually did disrupt biofilm. So just simply water picking can be a huge benefit. Why do we beat our patients up about flossing? You know they don't. Unless there's meat between their teeth, they want to get it out. People just don't feel satisfaction out of it unless there's meat between their teeth and they want to get it out. It's really hard to get patients to floss. So we need some alternative to flossing if that's the case. We just have to come up with some tools that they're willing to use and they can use safely and beneficial to them. Water picks are awesome for that. And again, I have no affiliation with them. I really am fascinated with how the research is coming in on these things. So I know what time are we at? About 45. Perfect timing. Dr. wanted me to try to keep you guys here because you're getting 3 feet. What's all about? Sneaking in the back door on our last one. Hey, I've given you at least 6 feet by now. So let's talk about how we can prevent some things from happening. This is the stuff I get super excited about. So when implants fail in non-smokers, there's a study called the PAZ study, P-A-Z. And they took a look at several hundred patients with failing implants. And one thing came in common. 300 times more likely to fail because they did not have enough vitamin D to begin with. You know what happens if you get injured and or burned the first thing you do when you go to the hospital, what do? They put you on an IV. What's in that IV? You know why? Because vitamin D is instrumental in helping you heal. It's also instrumental to your immune system. You want to know why so many people get sick certain times of the year? Your vitamin D levels are so low, your immune systems are shot. You got to get it up. You got to keep it up and keep yourself in that realm of where you can fight disease easier. So what we found was that vitamin D is a big culprit in implants. And so we really need to pay attention to what happens with these patients prior to and post-operatively with periodontal therapy, peri-implantitis. Remember, it's an inflammatory disease, and surgery. So when we combine all those things together, that's what was the most common reason. So we need to get their vitamin D up. So how do we do that? Do you go to Walmart and take a vitamin D? You pick it up off the shelf and say, today's the day. I'm getting me some D. I'm going down to the store and I'm going to get me 5,000 of D. Getting that sunshine would be very helpful for us. And I promise you won't get skin cancer in 10 minutes. So what do? Going to Walmart, going to Target, any of your stores and picking up vitamin D will benefit maybe 10% of the population to get it up. The reason is you don't have enough E and you don't have enough K. Without those really specific selenium, calcium, magnesium, we're all low on those too, unfortunately. Without those being at the right levels, you will not absorb the D. So you're basically peeing out most of it. So you need to pay very close attention to what you're taking in order to get that up. So how do you test? There's a couple ways you can do it. You can actually look at, there's Dr. Rick Myron has a little vitamin D testing kit you can purchase that you can do it chairside. Really fascinating. It's very sensitive. You have to do it exactly right. Or you can get a little way of reading. You can also just say, just go get a blood test before you have this vaginal dentistry done. Let's see where your D is. Simple as that. Very easy. So it's very important for your family and your friends. Anybody going through any kind of surgery should really have their vitamin D levels checked before. It'll really help a lot if you get that up. And then this is what we created. So this, you guys are seeing an old slide. This is going to be in about 10 weeks available to you all in a very, really nice, simple, easy way to help your patient called Denomedica. And what's important about this formulation is that it is all of these things. Vitamin, all the Bs, calcium, selenium, magnesium, K2, E. It's going to come in one bottle, not the two you saw. That one bottle, you take 2 vegetarian capsules in the morning and 2 at nighttime. You do this 4 weeks before surgery, and you keep going for 2 more weeks after. If they're diabetic, you need them on them longer. They're even worse. A lot of people are at 0 with D. So once you get that D up, then you want to keep it up while they're healing, and then maintenance. You can take this, but you take it at half the dose. 1 in the morning and 1 at nighttime. Your gut acts different at nighttime. So it's really actually a good thing to break up the doses so it absorbs differently. So look at all this power pack stuff that's in it. You do not take any other supplements. You actually just stick with this only. You tell your patients don't take anything else, just take this. Put away the rest of your C's and your G's, whatever else you're taking, and then you're going to just take this. So guess what? It has an awesome. Yeah, it is. We're all going to be 80 and look like we're 40. My theory. Between our PRF treatments,
Yeah.
we might make it. So this is what a testing kit looks like for vitamin D. A lot of the doctors will have this chairside, especially in the surgical practices where they are doing a lot of surgery. Your perio patients should be tested as well. They're going to heal a whole lot better, and they're also going to maintain a better immunity to those perio pathogens to help them keep those guys away. And the last part that I know that some of you are really the new frontier. This is a probiotic. We created 2 years to develop this. So how many people take probiotics right now? So it's really interesting to know what you're taking and what kind of probiotic it is. So we really focused on perio-pathogens. So Life made a double pack. I got one to give away. And I'll put it up here. And actually, you know what? I'm going to pass it around so you guys can see it. Inside it's a dual pack. There's an oral lozenge and a gut. And the gut is going to help your root cause because your perio-pathogens are coming not only from smooching, but it's coming from your gut. And when you control those pathogens with probiotics, you actually are killing off the bad ones because the good ones are so powerful. And we just don't have enough good ones as a general rule of thumb. So you have your patient swallow the capsule and you have a little oral lozenge and you float it around in the mouth and let it dissolve. Now you're working on both the gut and the oral at the same time. So what's different? We fed it. It's called pre-probiotics. Probiotics themselves are just as their own entity. We also did a post, which is giving your probiotics the nutrients it needs to survive longer. And we also did a spore. So whenever you go home and you look at your probiotics, look and see the spore, because spores make it through the stomach acids longer. That way they live longer and survive longer. So this is the new frontier, everybody. This is the missing link for perio. This is your patient that just doesn't ever seem to resolve and they do everything right. Give them some probiotics. Test their saliva, get them on probiotics, do your treatment, and test them again 30 days later. See where your pathogens are. Look at these strains. They were specifically targeting perio-pathogens, fungus, strep mutans. Look at this list. So these are the things that we want to achieve with our perio patient in particular that gets them into remission and keep them there. Can you take it every day the rest of your life? Of course you can. It's good for you. We need that good bacteria in our body. If you eat sushi, you need to take it. I love sushi, but don't look at it under the microscope. So good. So good. It's even really good at helping patients with halitosis because that's why you're smelly breath. Where is that coming from? Decaying bacteria. Bacteria, belly, you burp. You know, those are the kind of things that the reason those things happen is because the pathogens, the body has too many of them, and the bad guys win, not the good guys. So anyone who's on an antibiotic should be on a probiotic right away. And anybody who's got through scaling and root planing should be able to have the advantage of boosting those good bacteria to help fight the perio-pathogens. And then anybody who is in general health, I mean, you guys, all of us, we could very much benefit from a probiotic. You might just find that, you know, you feel a little differently after taking them too. It feels kind of like you feel better. And then you want to make sure that when you take these that you don't eat or drink anything. So it's nice to take it at night time before you go to bed even. So you don't have to worry about that. Here's the pathogens that we test with Life. This is a picture of our rinses. There's a coconut rinse and a peppermint rinse. These rinses are your go-to instead of chlorhexidine. You can replace it or have it as an alternative to chlorhexidine. It kills all these pathogens 99.9%, made with only plants and minerals. Very, very unique in what it can do. Doesn't kill strep mutans, doesn't stain. And on top of that, you use it every day, which is really a good idea, especially if you invest a lot of care in your dentistry. You want to maintain it. You want to make sure that your patients have the best effort at keeping things, and they actually taste good. They taste good. I couldn't bring any with me because I had to hop on a plane and I had to do carry on and they wouldn't let me. They always take it. Like, don't throw it away, just go use it. The also, I think what's important to note is we need coconut because we found that a lot of patients who went through chemo and radiation couldn't tolerate any level of peppermint. So you definitely want to have some alternatives for them. And that actually has more soothing qualities, lichen-planus, mucositis, coconut rinse and gel combo can be huge for these patients to help them heal and hopefully treat their disease. Here's how you're going to use our products in the perio world I mentioned earlier. You get yourself a little 3M syringe. Don't use anything in your cavitron, just use good water. Distilled water or whatever kind of water you want to use, clean water. When you're cavitroning, piezoing, you're flushing your all that debris, cleaning things up. Go behind it, use that 3M syringe with cellulite rinse and just flush that smoke. Get all that debris out. Remember, if you take a microscope down, you're going to see micro lesions. You're going to see little, like almost like keeper spores. So you want to heal that. So you flush and irrigate it with a non-killing fibroblastic product. And then you go right behind it with a gel. And you can apply that on the interproximal where the non-keratinized tissue is and on the margins, wherever you deem necessary. It could be everywhere. It could be just like specific. And you want to make sure that the patient's the why here is what's really, really important. One of my jobs is my life in dentistry was to be a treatment coordinator. And I sit down with the patients and I go over the treatment plan, perio, restorative, all of those things. The one thing that I learned in all the years of being able to do that is all you need to do is explain why. Why an implant versus a bridge? What's their benefit for them? What is it in it for them? So when you describe products that you're giving the patient, tell them the why. This is going to do this. This is going to do that. It's part of your care. You don't ask them, do you want to have a scaling replacement today? You tell them what your skill and expertise has taught you, that you have this going on and this is how we treat it, and this is what we're going to be doing next. You treat your patients and you explain to them like your medical doctor. Your medical doctor sees you. Do they say, "Got a chest x-ray today"? They say, "We're going to send you down for a chest x-ray," because they know that that's going to give them the data they need. So this is how you use cell life. It really does. You guys use it. Anybody else use it in the group here? So they probably have the most experience with it, and you can talk to the team about how patients respond to it. They really love it. They actually come back for more. So here's a few clinical slides at the end of our program. Here we're almost done. Lichen-planus, 1 week. No steroids, just rinse and gel. Why? Why did it work so well on this patient? Because we clean the bacteria, we decrease the inflammatory reaction, and we sped up those fibroblasts, make them heal. Now the key is prevention, right? We want to try to keep this from ulcerating and having these episodes. Autoimmune disease manifests itself in the oral cavity like this. That's pretty painful. Can't brush, can't do anything. So we put them on the rinse and gel, keep them on the rinse every day to try to balance that microbe. Now we'll be giving them oral and gut probiotics. So here's what the reason I'm here today is to give you guys some new tools. Cellulite has this recovery kit, and that has a rinse, a spray, and a gel. Think surgery, think diabetics, think about patients who are at higher risk. They need more. It's like a bad headache. You take one for not so bad, two for a bad one. So you need to think of recovery kits that way. The gel that I passed out, that's really fantastic as a pain relieving and swelling relief product. Really helps the after period feeling and root pain, decrease throbbing and sensitivity. And of course, these rinses, they're just really fantastic. It only takes 3/4 of a tablespoon. So those bottles can last about somewhere around 30 days. If they're using it 3 times a day, we want to make sure that they have the ability to last about 21 days on that. Yes. coconut rinse. She asked the chemotherapy patients with a lot of mouth work, inside and out, coconut rinse and gel. If they're really bad, recovery kit, take out the peppermint, make them have the coconut. It's fantastic for them. You know, right now the protocol is biotin and salt water, and it really doesn't prevent anything, and it doesn't really do much to heal. We've had so many friends of still like doctors who've had gone through the chemo and radiation in their mouth. They tell us all the time, if it weren't for that, I wouldn't have been able to eat. I would have had a feeding tube. So these are solutions, and everything's always guaranteed for your offices as well as your patient. If you give it to a lichen planus patient, nothing happens, not working, you let us know, we'll replace that product. Refund your patient, they buy it. We do it with all of our products. That's our guarantee to everybody, so it makes it easy. So here's your steps. This is what you're gonna do when you go back. I want you to really think. You can take a picture of this, because this could be your roadmap to change. You wanna think about testing, maybe test the water, talk to these companies, try it on yourself. Maybe what's in there. And try it. Even when you're challenging patients that you think, I'm gonna try everything, what else is left? Test them. And then get them on some oral and gut probiotics. Everybody, every perio patient should be on something like this. You want to treat disease before implanting. We want to help our doctors understand we want to get this environment under control before we do surgery. And then check those vitamin D levels before you do anything. Implant the patient or on surgery day, they're really healthier, really good environment to do surgery in. And then lastly, you want to maintain their health and balance of their microbes, because the gut is the second brain. So if we send them away, don't see them for a year, and they're a mess again, it usually has everything to do with what's happened in their gut. And what we're doing today is we have some solutions for that. So with all of that said, let me see that. I think this is it. I'm going to give you guys a promo code. So this is a promo code. If your offices, if your doctors would like to learn more and you want to sit with a team, I am all about, we all need to know. So reception, billing, everybody, join us for a 30-minute webinar training. We have to usually do Zoom in this area because we don't have anybody right here. But we will take a look and dive a lot deeper into cell life. Your doctors can see this. You'll get 30% off our product all the time. It's not a blue light special all the time. They don't do that anymore. Do they don't even have Kmart anymore, do they? Life goes on. So that's my contact information. That's my email and my cell phone. I better not see that in any bathroom wall. I get a funny call. I know it's probably one of you guys. So I want to thank you all. This is for you guys. I hope you enjoyed this. I hope you learned something new. I hope there's something that you can take away from this today and say, I really can make a difference. I really want to make a change. And I really want to maybe take those baby steps to start with one plan. Think about what you want to do. Think about what you want to change, and then just go and do it. Get your data, find your results, watch your patients, see how they respond. You'll love it. You'll feel so empowered that you have some tools. And again, thank you guys so much for having me. Thank you guys so much. So much. If you have any questions, I'm going to stick around for just a little bit, and I'm going to
Did you pick a talk already?
sitting.